Thank you. Good morning. I'm here today to present some very preliminary results on a survey that was done in Nigeria, and I'm presenting on behalf of my colleagues over there, which are part of the Adolescents Living with HIV Health Project. And my name is Brandan Brown. So I included a brief background here. So the reported prevalence of sexual violence and rape in sub-Saharan Africa ranges up to 40%, and it's kind of become normalized, sadly. And in a 2012 survey of HIV/AIDS, it was reported by both men and women that beating your wife is justified if she refuses sex. So these are the kind of things that we're facing over there. Adolescents worldwide are kind of facing a fast-growing epidemic of sexual violence, but little is known about the experience of adolescents living with HIV and their experience with forced sex and rape. So you can see here just a few newspaper clippings that I came across, and these are published several times per day by various NGOs and community organizations. But there's really been no information in the academic published literature in this topic. And just to give a little bit of context, so a lot of these showings of what's happened in the media with rape are kind of overshadowed and devalued and trumped by statements of kind of well-known politicians who say that, okay, this happens, but the way to prevent this is for women to shave their heads, to not bathe, and to iron their breasts. So this kind of thing is really trumped from a top-down approach with people saying how they think rape can be prevented. So we looked at a cross-sectional survey in Nigeria among about 1,500 adolescents, HIV positive and negative, in 12 states, so including both North and South. We found that the average age of first sex was about 15 years, with girls having a much lower age than boys. And about 6% of sexually active males and 31% of sexually active females reported forced sex, with a lot more women reporting forced sex at their first sexual debut. And significantly more women or adolescents who were living with HIV had experienced forced sex compared to their HIV-negative peers. And we could try and unpack this in different ways in the question and answer session. So in general, obviously a lot more work is needed to kind of unpack the experience of adolescents living with HIV and why they face a much higher prevalence of rape. The issue of rape in Nigeria definitely needs more attention. So far it's been a kind of a bottom-up approach, but it's reached a lot of barriers by things that are said by politicians and people in power at the top, with the example that I gave. So we know that rape might contribute to the increased incidence of HIV infection in females. And really, if you look at this figure, so 31% prevalence of rape, just in this one survey, and this is only among adolescent girls who reported being raped or forced sex to the interviewer. So obviously 31% to me sounds like an epidemic, and we have to work in different ways to educate the public. So this is kind of echoing what we've heard through the past few days here with focusing on male engagement and male education. One kind of positive thing that we found over there is that rape victims do have access to post-exposure prophylaxis. But sadly, the uptake is pretty low due to various issues, including stigma and poor awareness. So we can see here with the figure 6 of 559, so about 1% of adolescent girls who reported rape actually completed post-exposure prophylaxis. Guess I have to end there. Thank you.